Hi, I'm Nathaniel Lee. I'm a surgical oncologist. I've been practicing with Community Physician Network since 2021. My fellowship training is in complex general surgical oncology, which is a very broad category of disease. My position here is primarily focusing on the hepatobiliary and pancreatic cancers. So those treating liver, pancreas, bile duct cancer, and benign diseases. That is the primary focus of my practice. But in addition to that, because of my specialty training is so broad, I have the tools and the knowledge to take care of gastrointestinal malignancies from the top to bottom, basically, of the abdominal cavity. So I treat patients with gastric cancer. I treat patients with GI stromal tumors. I treat patients who have neuroendocrine, GI neuroendocrine tumors. I treat intra-abdominal and retroperitoneal sarcomas. And in addition to all of those things, I also have training and skills to take care of patients who have high-risk skin malignancies like melanoma. So I have a broad set of tools and a broad set of interests, a little bit outside of my official designation as, a liver and pancreas surgeon. Whenever it's possible, I like to offer my patients minimally invasive surgery, whether that's laparoscopically or robotically. The reason why I emphasize this in my practice is patients who've undergone minimally invasive surgery often will have lower pain, less need for opioid pain medicines, quicker return or quicker discharge from the hospital, sometimes a quicker return to work. And so these benefits pay off in patients' lives where they get back to normal sooner. And so whenever it's possible, I try to offer my patients a minimally invasive surgery. For many surgeons, the length of time that they are really interfacing with a patient is pretty short. But for cancer surgeons, you're meeting patients when they're often going through some of the darkest times of their lives, and you're helping them through that. And then after all of that and helping them recover from the surgery, then you can follow those patients and celebrate those successes for years. And that is an opportunity that you get with cancer surgery that you really don't get with most surgical specialties. And that really, really drew me in. Every time I have the chance to meet a new patient and help them along with their treatment plan, anytime I get to go to the operating room and operatively solve complex problems, it just invigorates me. There's nothing like having a long day in the operating room and knowing coming out that person got exactly what they needed, everything went to plan, and that they're going to have the best chance possible for a good outcome or hopefully a surgical cure. I'm Nathaniel Lee. I'm a surgical oncologist. I've been practicing with Community Physician Network since 2021.